It's the Thursday Morning House Call with Dr. Lane Aiena. Brought to you by Huntsville Memorial Hospital.
Good morning. Big Lynn with you in studio with me, Dr. Lane Aiena. Good morning, Dr. Lane.
Good morning. How you doing today?
Hey, it's Friday Eve. We're a day closer to the weekend.
We are, and as you just told me before we turned the mics on, looks like a cold weekend.
Yeah, we got a cold front coming through this weekend. Sunday night and then Monday night. We're going to look in the mid to upper 30s both those nights.
Whew, folks, I know you just hooked your hoses back up. Well, unhook them, cover them back up.
Yeah, we just took the electric blanket off the bed.
You know, just make the decision, Texas weather. I'm over it. I'm sick of it. So,
okay, what are we talking about today?
Well, last week, we talked about how it's February's Heart Health Month, and big deal for me, big deal for all of us, you, the listener, as well. And I got so into the first few points, I had to rush through the last few points, which is pretty typical for me. So one of them that I actually said, we can make a whole episode over this is sleep. And we may have done something like this once before, but I don't think we've done it with the angle of heart health and where that applies. We talk about blood pressure and heart health. We talk about cholesterol. We even talk about blood sugar and how all of this applies to the heart. Very rarely do we bring up the correlation between good quality sleep and your heart. So how do those tie in? Well, when you sleep, your heart rate goes down, your breathing rate kind of levels out, goes down a bit as well, and your stress hormones in your body also go down. This is kind of a selfish topic as well. The past few weeks, I've been tracking my sleep and trying to improve it. I've got a watch that can track my sleep. And seriously, if you do the right things, you can watch how your heart rate trend goes down overnight. It's incredible. It really does work, When you are not sleeping or when you're getting restless sleep, not sleeping enough, not sleeping well for one reason or another that we'll talk about, your heart rate stays up, so you're stressing your heart all night. Your blood pressure will go up even during the daytime. Your insulin resistance, meaning your blood sugar, will go up, and your stress hormones go up. Cortisol, we hear a lot about cortisol. That will go up as well. Every once in a while, that's probably okay, but if you're doing that chronically, that's going to put you at an increased risk for heart attack, stroke, high blood pressure, like I mentioned, all of those negative effects that we try when we're awake to bring down. But what about that 1/3 of your life that you're asleep? You could be affecting it then. So what are some things to look for sleep? One of the biggest heart issues and sleep correlates that we need to think about is sleep apnea. If your partner tells you, hey, you snore a lot, I've caught you gasping at night, these are big reasons to go talk to your doctor. Now, let me get ahead of you right now and say, I know nobody wants to wear one of those masks. I get it, but I'm telling you, folks, the patients I have that have gone to their doctor come to me and said, Doc, let's do it. Let's get the sleep study. And they get the mask. After that introductory period, when they're getting used to it, it will change their lives. They feel better. They have more energy. They say, I forgot what it was like to be awake. It makes a huge difference. So if somebody is telling you, hey, you're snoring a lot, or let's say every morning you sleep all night, you go to bed at the right time, you wake up, you're still tired during the day. Maybe you don't have somebody tell you you're snoring. Come talk to me. Go talk to your doctor. Sleep apnea is a big reason for bad heart health, for increasing that blood pressure, increasing that stress. You're not breathing all night, so you're stressed all night. Folks, it is so important. New onset AFib, even that. Come talk to your doctor. We need to get you a sleep study because you're increasing the stress hormones, which kick you into AFib. Now, not as extreme, just want to get out there, but not as extreme is the easier things we could do. Things that I'm working on. Good bedtime. Make sure you have a consistent bedtime, even on the weekends. Your body loves patterns, so make sure you're giving it that. One thing I talked to a patient about just this past week that people don't realize is while alcohol helps you fall asleep, it ruins your quality of sleep. So don't drink before bed. Every once in a while, you're probably okay, but it gets real easy to fall into that habit of, well, once we get the kids down, I like to have a couple cocktails or a beer, or, I have a beer with dinner or 2 beers with dinner. It's very common, and if you tell your doctor I drink 1 to 2 beers a day, they'll probably say that's probably not too bad. Just watch it. But that can really affect your quality of sleep as well. Make sure you have a dark room. Make sure you have a quiet room. Make sure 30 minutes before bed, an hour before bed, you are not turning on screens. You're listening to a book. You're reading a book. You're listening to music. You're reading a magazine. That'll help your eyes tell your brain, hey, it's dark out, bedtime. You get that good quality sleep. Good dark room, good cool room. Now, there are some things we can't fix. 4 children coming into my room all night. I've yet to figure out how to fix that. But there are some things that are outside of our control. But folks, those are some things you can work on. Make sure you're working on your sleep hygiene, getting a good bedtime. If you snore, if you're waking up tired with headaches, call me. Call your doctor. Don't drink before bed. And just make sure that you are really getting those 7 to 8 hours of quality sleep to get you in the good health you need to be in for you and your heart.
Great advice from Dr. Lane Aiena. Fantastic. Get that sleep.
Absolutely.
Get that sleep study.
Get those Z's.
There you go. That's this week's edition of a Thursday Morning House Call brought to you by Huntsville Memorial Hospital.
Let's keep Huntsville healthy.